What's up, it's Dr. Allen here at Evolve Chiropractic in Woodstock. I wanted to go through some frequently asked questions I get here in the office. One of the main questions I always receive is, what is an adjustment? What is that popping sound that we hear when you do an adjustment? So essentially, an adjustment is a way for us to tell the body that it's safe to move into a direction that it's not used to moving. So we call these adjustments to areas of the spine that are restricted subluxations. Subluxations are basically areas of the spine that are not moving properly. Some people, there's like a common misconception that there's a bone shifted out of place or popped out of place, and what we have to do is pop it back into place. That's not really what's happening at all. What ends up happening with the spine is that different stressors, whether they're acute or prolonged over time, like postural strain, we're sitting at a desk, our head comes forward like this. What happens is the ligaments stretch and then they kind of solidify themselves into a different position or a deformed type position. And then the body gets stuck there. And what ends up happening over time is that the joint starts to wear down, or there becomes strain on the muscle systems that kind of connect those vertebrae together. So when we do an adjustment, we're essentially just telling the body to shift into a position of relief or relaxation into that ligament. So the popping sound that you hear is basically when you have a joint surrounded by a capsule, there's fluid inside that joint, which is called synovial fluid. And inside that fluid you have dissolved gases like nitrogen and hydrogen. Now inside this little capsule is essentially a vacuum. And when you open up space within that vacuum, you create a negative pressure. And all those gases then come together and they form a bubble. So the formation of a gas bubble inside that fluid is really what's happening when we do the adjustment. So again, we're not popping bones back into place or anything like that. We're essentially training the body that it's safe to go into a new direction, and then that gas bubble formation creates space inside the joint. So like when I crack my knuckle, I can crack it once, but I can't crack it again. That gas bubble is still floating in that joint space, creating space between the two joint surfaces, allowing for better movement, mobility, different things like that. So the popping sound is not necessarily the most important part of the adjustment. I try to tell people, don't be a crack addict. Don't really expect that popping sound with an adjustment, because sometimes you can do an adjustment, you don't get that sound, but you're still training the body that it's safe to move into that direction. And over time, your body's gonna recognize that position as neutral. So hopefully this helps relieve any of your questions or concerns about getting adjusted. If you have any questions, feel free to reach me here at the office. Be safe, have fun, get at it, and I'll see you soon.